when I first started with DMOR 3 years ago, I was using the NeoPerfect, and wonderful results with it. It's got collagen, hyaluronic acid, peptides, botanicals, and allowed me to go ahead and put something very high quality into the skin, down into the dermis, where I was actually seeing some good results. Patients were getting plumper, smoother, and it worked well. When we got the new NeoVital, I was just absolutely happy with this, because this allowed me to go ahead and add exozymes into it. And with that, I was able to actually start repairing, regenerating. I'd been doing PRPs for years, and I'd gotten switched over to some stem cells, also stem cell therapy and injections. And as we realized what was actually working on the patient, what was actually making them younger, healthier, and fresher, we realized it was the exosomes. The ability to offer this to my patient is the highest quality exosomes available is just wonderful. We're seeing excellent results with that and using it in regeneration. So again, it's a standalone product. They can take the Neo Exo Perfect home and use it there. They continue the medical product experience at home. But here in the office, I can use the Neo Vital along with either the Neo Ideal or the Neo Perfect in order to put into the skin to follow a procedure and allow it to heal faster and better and younger and healthier. So it's really nice to have these products available. A major part of our practice is repair of skin, photoaging, photo damage, other difficulties we have, or for that matter, hair loss, whether it be male or female pattern hair loss, or even alopecia totalis, universalis, or alopecia areata. So with hair regrowth, we find that using the NeoVital products with this, they were able to go ahead and following a procedure, especially an ablative procedure, microneedling or radiofrequency microneedling, or using our plasma pen, or using laser resurfacing, or just simple microdermabrasion, that we're able to go ahead and allow the skin to repair, heal, and give it 2 or 3 months of a kickstart on getting new healthy tissue into the area. And again, if we can reverse those signs of aging by reversing the process of damage causing the aging, then it's a benefit for our patients. It makes us very happy. We're really excited now with using the Neo Ease. For a medical spa, why would we want that? Well, it's a full service medical spa, and we're finding some wonderful results with this. It's a cannabinoid, but it's different than what you're going to get at the CBD shop. It's a very high quality cannabinoid. It's using multiple factors within that cannabinoid so that it's very, very effective. And we're finding it used, one of the patients, or actually several of the patients are using it on, have knee pain, knee problems following joint replacement. And they were developing little contractures, and they were having a lot of pain in their knees. And so we went ahead and added this to a treatment, driving it into the skin, beneath the skin. And we're able to give them function back in that knee, give them a range of motion that their doctors were absolutely astounded. They had thought they'd have to go back and do some surgery to loosen things up, but they made them functional again and really decrease their pain. And now that we have it also in the ability to send it home to the patients, they continue treatment at home, we're going to be doing this. But we also use it in our massage therapy with our therapist, and she can use it on painful areas that she's massaging. We have also estheticians who use it as an add-on if they're doing a facial or a small procedure, and talk to the patient, and are you hurting someplace, touch it into there. And again, this gives them something they can take home also and continue the treatment at the house. We're looking forward to using it for other things to find out really what can we use it for, what works, what doesn't work. So it's exciting to have this added on to our practice. We understand also that we're going to be able to get this pretty soon in a tincture form. And for us, it's important because we have a lot of patients with anxiety that come in if we're doing a procedure. They may not have had something done before, or they're worried about it. Maybe they have had it done before and they were uncomfortable doing the procedure. So we're able to use nitrous oxide, but that's bulky and cumbersome. But with this tincture, we'll be able to go ahead and give it to the patient prior to the procedure. And we'll see if it will relax them, make them more comfortable. Talk to our massage therapist. She wants to go ahead and use it again by relaxing the patient, making them more comfortable where they can go ahead and just experience the whole atmosphere of a spa procedure in a medical spa setting. So anxious to come out, I'll be using it as soon as it's available. The other product that we're really anxious to start using more of is NeoSmooth. We see a lot of cellulite. I heard a few years back that women over the age of 40 could be put in two categories: those who had cellulite and those who thought they had cellulite. So it's a very, very common problem. But you notice you don't see cellulite in men, and you don't usually see cellulite in younger women, whether or not they're overweight or not overweight. And likewise, in older women, you can see cellulite even if they're not overweight. So what is cellulite? Well, we know it's the fibrotic bands that's down in the fat tissue. In a female, they're arranged parallel to each other. In a male, these fibrous bands are crosshatched. So what happens, these fibrous bands get weaker and stretched and damaged. And it's mainly the fibroblasts that are down there that make the collagen to get older, and part heredity and other things, so that the fat lobules that are between these fibrous bands will herniate up, cause bulges of the skin, cellulite. So we used to have to break apart those fibrous bands and get in and damage and irritate them or try and shrink some fat. But now with this, with the NeoSmooth, what we're able to do is actually repair the fibroblasts that are down there to make healthier collagen, healthier elastin down in the subcutaneous tissue. Now, this is something the patient takes home with them. So we have procedures we do here in the office, whether it be using red light or some of our other procedures also, that we can do a medical spa procedure on them, with the ability now to send them home with something that they can use to continue the treatment between our therapeutic sessions. Really gets me excited, and I can't wait to start getting some results back on there. Because as a dermatologist, metapathologist, I know what's going on underneath there, and the fact that I can possibly repair and treat these things just gets me very excited. In our practice, we've added the NeoVital with our NeoIdeal in order to deliver the NeoVital into the tissue. The NeoIdeal is a very high molecular weight hyaluronic acid, and because it is such high molecular weight product, it's able to drive our exosomes, our NeoVital, deep into the tissue, down into the dermis, and even down into the subcutaneous tissue, using one of the devices that we have to help drive. So the combination of the two really work nice. If you try to use just the NeoVital alone, which is a liquid, you can get it dripped. You might get a little higher concentrations in one area versus the other. It's more difficult to get it all over the area you want. But if you'll blend it in about a 5-to-1 ratio with the NeoIdeal, and then go ahead and place it on the area you're treating. We use it, we treat erectile dysfunction in males, and we use that as part of our treatment about once a month, in between using our Zimmer device as a shockwave treatment. But we also use it when we're treating male and female pattern alopecia, or an alopecia totalis or alopecia areata, in order to drive it into the treatment area. And when you're putting it into the hair, if you'll go ahead and use it with the NeoIdeal, it's easy to put it in the region you want to treat, and you know you're getting a uniform deposition of the exosomes, which is a vital part of this. And as far as cosmetically, if you're adding a hyaluronic acid into it, or if you go ahead and use a NeoPerfect, you're adding some collagen and peptides into it also, afterwards the skin just looks and feels so much better too. So the patient feels like they're getting a better result with it just immediately, just from having the collagen and hyaluronic acid there. So I'd recommend you use something with your NeoVital, but use something that's safe to go under the skin, down deep into the dermis. Most things out there aren't safe to go down there, or they're not going to effectively push your exosomes down deep. So critical what else you use with that. I've mentioned in treating these patients that we use a device to help drive these products into the skin, through the skin, down into the dermis, and even the subcutaneous tissue in the joint areas. It's using predictive permeation, which is an electrical current at a certain frequency, an exact frequency that opens the pores between the cells in the skin. So the company that has this device is affiliated with these same products, and it's exciting to use the two together. It can be used as a standalone. It will penetrate beautifully, but the fact that I can drive it into the skin deeper is just a win-win situation for my patients. So look for some future things with this, with predictive permeation, and see how you can add that onto your spa procedures or your medical spa procedures to make the patient healthier, happier, and get better results.